My topic is gallstones. Some common questions people have about gallstones is where do they occur? Why do they happen? What is the difference between a kidney stone and a gallstone? What does it feel like to experience a gallstone? What is the treatment? And is there any possible complications? So gallstones happen in the gallbladder. And the gallbladder is defined as a non-essential organ that is attached right below the liver in your abdomen. As noted in the picture, it is the little red organ located in the abdomen. I really enjoyed this description of the gallbladder as WebMD describes it as a balloon. And before you eat your meal, it is a fully inflated balloon about the size of a pear, and after you eat, it is a deflated balloon. And that is because when you eat your food, it releases all that bile so that your small intestine can break it down. I thought that was a really cool explanation. How does your gallbladder work? The gallbladder receives signals that in response secretes bile, and it secretes it into the small intestine through bile ducts. The main concept of bile is to digest fats and other nutrients. What is a gallstone? A gallstone is defined as a buildup of deposit within the gallbladder. These deposits are made of digestive fluid, also known as bile. These have hardened because the gallbladder was not able to properly release as much bile as intended to, and that causes the buildup of excess fluid. The average stone can range from about a single grain of sand to about 2 to 4 centimeters round. There are two different types of gallstones. One type is cholesterol stones. This is the most common type of gallstone. 80% of gallstones are these cholesterol stones. They are green and yellow in color. Some of them, as you can see in the picture, are a little bit brown, and they're very large in diameter. A person will experience this type due to an undissolved cholesterol remaining in their gallbladder. And also, a person who experiences high cholesterol will have an increased chance of having these cholesterol stones. The second type is pigment stones. These are much smaller in mass and diameter than the cholesterol stones, as noted in the picture. While 80% of the gallstones are the cholesterol stones discussed in the previous slide, the other 20 are these darker stones. These stones are composites of bilirubin, which is a substance that is formed from the gallbladder's own bile. So while the cholesterol stones were a cluster of cholesterol, these are an excess clump of bile. How do you get gallstones? There's not a very clear explanation as to why someone may experience the gallstones, but some factors may include your weight. Sometimes it's just your genes. Problems with gallstones may run in your family. If you have gallbladder complications within your family, your chances of having gallstones does increase. If your gallbladder is not functioning as it should, it could result in an overproduction of bile, and that could lead to gallstones as well. Poor diet may also be a factor. If you have a high intake of fat within your diet, you may have that buildup of fat and you may get the cholesterol stones, or you may get the bile because you may have to produce more bile than your body is intended, and that may lead to an excess amount of bile, which could cause gallstones. So some people commonly get gallstones and kidney stones confused, and they're very similar. However, it's basically just the organ differs. So gallstones are hard lumps of bile, and kidney stones are mineral lumps. Gallstones and kidney stones can be asymptomatic, but most of the time a kidney stone is extremely painful, and you know when you have one. Gallstones, on the other hand, you may experience as panics. They're called attacks of pain. So they may come and go. You may experience a huge sharp pain within your back region, and then it may go away for a little bit. Stones have to be blasted if they're too large to pass through the ureter. You can get rid of your stones naturally. However, if they are too large to pass, they become extremely painful and surgery may be needed. On the other hand, gallstones removal is necessary. They don't just disappear on their own. You can receive medication. However, gallstone removal is more common than someone receiving medication to remove a gallstone. Another similar thing about gallstones and kidney stones are the symptoms. The symptoms are very similar in actually the body regions, the type of pain that you feel. However, in gallstones, the symptoms are constant. In kidney stones, the symptoms come in spurts. And kind of a similarity I like to make is my kidney stones run in my family. And my mom actually experienced kidney stones to contractions in labor because you're passing them. It comes in spurts. So, kidney stones come in spurts while gallstone symptoms are very constant. Some of those symptoms are pain in the upper region of the abdomen, pain below the breastbone, back pain that is located between the shoulder blades, nausea, and vomiting. The diagnosis is pretty clear. Doctors may request a CT scan, and this would give them an exact image of your gallbladder and how it is looking within your body. If it is inflamed, that is an indication that something may be going wrong. A blood test to see if there's anything that could lead to the final conclusion of gallstones. If your pancreas is inflamed, infection, etc. Dye test. They actually can insert a dye within your gallbladder that lights up your bile ducts to detect to see if there's any stones blocking your bile ducts. Complications. There are many complications that could arise from someone who has gallstones. The three pictures are a gallbladder, the pancreas, and someone who is experiencing jaundice. And if you look to the far right upper picture, there is a normal gallbladder and an inflamed gallbladder, and that will be noted in your CT scan. Jaundice is a result of bile being blocked. So if you have a blockage of your bile duct, you may become jaundice, which is just a yellowing of the skin and your eyes, and it is very clear to someone who is becoming jaundice. A pancreatic duct blockage, which could result in an inflamed pancreas. And last but not least, gallbladder cancer, and it is very rare. However, when stones are present and they occur often, your chance for the cancer increases. Treatment: a cholecystectomy, also known as a gallbladder removal surgery. When this surgery is performed, there is no longer a storage for your bile. Instead of a gallbladder storing the bile, it goes directly from the liver to the small intestine for digestion. Another treatment is medication. This medication would dissolve the gallstone. However, sources say that medication is normally reserved for people who cannot undergo surgery. This medication could take a longer period of time to dissolve versus surgery, which would be an immediate removal of the gallstone. And this also makes the chance of them coming back greater. Also, another side effect of medication being prescribed, if it is discontinued, the gallstones have a tendency to come back.